The subject may sit or stand. The examiner sits next to the subject. The subject is instructed to hold a piece of paper between the thumb and index finger. The examiner then tries to pull the paper out. A positive finding is found if flexion of the subject's distal interphalangeal joint of the thumb is indicative of an adductor pollicis longus paralysis due to ulnar nerve damage.
Watson test. Test positioning. The subject sits. The examiner uses one hand to stabilize the distal forearm of the distal radial ulnar joint while grasping the scaphoid bone of the subject with the other hand. Action. The examiner mobilizes the scaphoid bone anteriorly and posteriorly while ulnar and radially deviating the subject's wrist. The positive finding includes a palpable subluxation and reduction of the scaphoid. It may be felt if the underlying carpal ligament tear is present.
The subject may sit or stand. The examiner stands in front of the subject and holds the subject's finger in extension, except for the finger being tested. The examiner isolates the distal interphalangeal joint by stabilizing the metacarpal phalangeal and proximal interphalangeal joints of the finger being tested. The subject is instructed to flex the finger being tested at the distal interphalangeal joint. The examiner isolates the proximal interphalangeal joint by stabilizing the metacarpal phalangeal joint. The subject is then instructed to flex the proximal interphalangeal joint. A positive finding is found if the subject is unable to flex the proximal interphalangeal joint. Both the flexor digitorum profundus and the flexor digitorum superficialis muscles tendon and or nerve are compromised. If the subject is able to flex the proximal interphalangeal joint but is unable to flex the distal interphalangeal joint, then only the flexor digitorum muscles tendon and or nerve are compromised.